Thank you for joining Cancer Support Community Atlanta for over-the-counter options in oncology, facilitated by Houda Aboujamous with Northside Hospital Cancer Institute and moderated by Jennifer Webster with Georgia Cancer Specialist. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Thank you all for joining us today for this program on over-the-counter options in oncology. This is Emily Brown, the Program Director at Cancer Support Community Atlanta. We do these education programs every month, and we invite you to join us for all of our programs. You can learn more at cscatlanta.org. But without further ado, I'm going to go ahead and introduce today's moderator, Jennifer Webster.
Hello, everyone. I'm Jennifer Webster. I'm a clinical nurse specialist at Georgia Cancer Specialists, and we're a large private practice that's affiliated with Northside Hospital. I oversee staff and patient education, and I was really honored to be asked to moderate this session today with a colleague that I've worked with for many years, Houda Aboujamous. She is your speaker today. She has an incredible wealth of knowledge, specifically in oncology. She has specialized in oncology pharmacy for many years, and I'm absolutely delighted to introduce her. Before she gets started, I just want to say that I will be the one moderating the chat, and I'll look, and as you have questions, I will write them down. We may not get to your specific question. If we have lots of questions, I may be having to group them into big themes so that we can get most people's questions answered. Anyway, welcome to Houda, and I know you will enjoy this program. Thank you, Houda.
Thank you so much, Jennifer, and thank you everyone for joining us today. Again, I'm Houda, and I'm a pharmacist working specifically in the care of patients with cancer here at Northside Cancer Institute. Some of the natural questions, and that's no pun intended, to have concerning your care really revolve around potential over-the-counter options. Specifically, what can I take? What should I stay away from? And perhaps, what could I be taking or looking into to take to further help me and my overall health? These are some of the questions we hope to answer today. So now jumping over to our agenda, we hope to, in our various topics, we will discuss common over-the-counter medications and potential issues to be aware of with these over-the-counter options. Now, it's important to realize there are medications and then there are dietary and natural products, and we will address the difference between medications and dietary or natural products, as well as discuss important properties to look out for when it comes to selecting products. Further, we will consider the important potential for interactions that exist amongst products. Also, we all hear that certain vitamins and herbs can potentially therapeutically help in a cancer diagnosis, and we will examine some of these vitamins and herbs and some of these claims specifically. We will especially focus on antioxidants, vitamin D, and turmeric. Other herbal products have been proposed for helping with the adverse effects of chemotherapy, and we will examine some of these. Further, as mentioned, interactions can potentially exist among all the medications and or dietary supplements you may be taking. I'm sorry. And we will examine some of these drug interactions and by what mechanisms they may present themselves, and further review some examples of interactions that exist in cancer care. Lastly, we will provide some resources to help you navigate the important consideration of using over-the-counter products, because again, we will discuss many options today, but it's important to know what your resources are. Always look something up, always consult, and I'll be saying this will be a recurring theme throughout this presentation. Always consult your healthcare team. Look for the most updated information. You are your advocate for your care, and we want you to be as equipped as possible. So one concern with over-the-counter medications is that they, in some instances, may mask or other instances potentially exacerbate the symptoms of a more serious underlying health issue. One thing we are always on the alert for in treating cancer are signs and symptoms of infection, because many types of chemotherapy medications can weaken the immune system, especially medications treating blood cancers versus a solid tumor. But it really varies depending on the specific chemotherapy agent and the effects on the patient. And it varies patient to patient as to how much the immune system may be suppressed. Now, looking at a specific medication, acetaminophen, better known as Tylenol, and then your non-steroidal anti-inflammatory drugs, better known as NSAIDs. Such examples of NSAIDs are ibuprofen, naproxen. All these medications are often used to treat pain. They're over-the-counter options. But the one thing to be aware of is that they also work as fever reducers. So these medications can exist alone or can be one of the ingredients in another medication. Common example being your cold and flu products. They often contain Tylenol. So if you take over-the-counter Tylenol or an NSAID or a medication that contains any of these medications, you should talk to your healthcare team. Your healthcare team may prescribe an alternate medication to not mask the fever, because fever is often a sign for us as the healthcare team as to a deeper potential infection that's going on or a deeper problem. So we could potentially look to alternate medications that both treat your pain or whatever problem we're attempting to address with these products, but at the same time not mask a fever. One other thing to note about specifically NSAIDs is that they have blood thinning effects, and therefore most often when treating a solid tumor, we're really less worried about infection happening and therefore masking an infection. So in these cases, Tylenol may be a better option for pain relief rather than an NSAID, just so we can avoid those potential blood thinning effects. Now, looking at the class of antidiarrheal medications, such as Imodium is the common brand, loperamide is the generic name. These are not advised without first talking to your healthcare team because, of course, when taking these medications, trying to prevent diarrhea, but diarrhea could also be a side effect of chemotherapy. Specifically, some instances, a sign of an infection that comes along with chemotherapy, or it could be a sign of another complication of your treatment or disease. So again, please, recurring theme here, consult your healthcare team prior to adding on any sort of medication. So now the options we discussed in the previous slide, such as Tylenol, these are categorized as, of course, over-the-counter medications. At the same time, we have over-the-counter dietary and herbal supplements. So the question becomes, what's the difference between a medication versus a dietary or herbal supplement? So let's first consider how they are either or are not regulated by the FDA. So starting with medications, the FDA has to conduct clinical trials to show that these medications are safe and will have the proposed clinical effects. This all happens before your doctor can prescribe the medication. For supplements, these, whether herbs or vitamins, are essentially treated like food products in our overall regulating system, where they don't have to be tested. They're self-regulated by the manufacturer instead of the FDA, and so the people that make the supplements are in charge of monitoring them. And in fact, the FDA only steps in when the supplement causes a health problem. So a good overall way to think about drugs versus your herbal or dietary products is drugs are considered unsafe until they're proven to be safe, while your supplement products are considered to be safe until they're shown to be unsafe. So a very important distinction there. So although medications and supplements are different, they are processed by our body through similar routes. When you have multiple chemicals or compounds being processed by your body, depending on the exact route they're processed, there can be interactions between these different products if they are being metabolized by a similar route. So a disclaimer, You could be on many medications and or supplements and not have any interaction, but it's important to always check if your medications or supplements interact. And this is where your pharmacist, your physician, overall healthcare team need to be in the loop on everything that you're taking. So we can check for interactions and also help you make sense of the significance or insignificance in some cases of these interactions. So a little bit more about drug interactions. By definition, drug interactions are the effect of one product, whether it be a medicine, herb, or other plants or plant extract, on the activity, metabolism, or toxicity of a medicine, herb, or other plants or plant extracts. So as we mentioned, once your body sees these products, they are metabolized and may compete for metabolism. Also, one other thing we consider to predict the effects of metabolism is how these products may or may not have effects on enzymes used in metabolism. So if you have ever had a deep discussion with your provider, or maybe you're in healthcare or in the scientific field, a major class of these enzymes belong to the cytochrome P450 pathway, which again, you may hear mentioned, or if you read about drug interactions, this may be something that you come across. So when thinking about drug interactions, it's not as easy as saying product X and product Y interact. Beyond that, we have to consider patient-specific factors, including but not limited to the age of the patient, gender, disease state, organ function. Primarily here, we're looking at liver and kidney as they help in metabolism and excretion of products, your diet, and even genetics. These are all things we consider when considering the potential level of exposure you may have when taking a specific drug product. Regarding the specific herb, we have to consider species, parts used, quality control, which we will look at more closely in coming slides, as well as the dosage and the duration of use. And for drugs, the dosage may make a difference as to the level of a potential drug interaction, route of administration, whether it's by mouth, intravenous, that affects also how your body processes it, because we have certain drugs, an example, well, without going into examples, but we have some drugs that may be given by different routes. They're the same drug, but route of administration affects that, how it's processed by the body. So now to reiterate, any person must be cautious when taking supplements due to all these considerations, but when focusing on patients receiving cancer treatment, this patient must be extra cautious. As I'm preaching to the choir. I know you all are taking control of your care and whatnot, and you know how much considerations and how stressful everything can be. But this patient must be extra cautious when using dietary and natural products, as you and your medical team are, of course, working out a plan to plan everything as much as possible to the last detail. So some of these supplement products can interfere with surgery. You all, I'm sure, have experienced this even with medications. These products, as I've been discussing, interfere with potentially with chemotherapy, also possibly even interfere with radiation therapy. And these supplements, just at the same, while they may help with a certain therapeutic problem or side effect that we're trying to address, they of course come with potential side effects. And I have a whole list of side effects here, from cardiovascular effects, anything from high blood pressure to potentially risk for stroke, heart attack. And this is not to scare you, but these are things that we have to be very careful when thinking about adding on any sort of therapy. All this, we can't say this enough, contact your doctor right away. Say you start a product, we don't anticipate any problem, and you start having problems, please let your medical team know. And these, I'm sorry, I'm not sure what just happened. All right. Yeah, so essentially the best approach is to loop in your medical team on everything so that, you know, we are aware of everything and can advise you as best. So now, before I completely paint supplements in a bad light, as there are some risks, some are very much needed, and dietary and natural products can have their place in helping maintain our health. A common example is folic acid for pregnant women to help prevent major birth defects in the baby's brain or spine. Another example that we know of is vitamin D, as most of the population is vitamin D deficient, and we will look at vitamin D more closely. But before we do that, to help you determine which product to buy, as there are many brands out there when it comes to supplements, it's always important to look for the following things. Buying only one single ingredient product approved by your doctor. So some products contain one product that you're trying to target, but then other unlabeled herbs, pesticides in some cases, prescription drugs, heavy metals, other substances, and also make sure the bottle clearly shows how much each dose or what's the dosing of that specific product. This is very important. Use brands from companies you or your doctor deemed trustworthy to help guide you to these brands. There are certain certification seals or marks from independent third-party organizations to look out for. So these include the U.S. Pharmacopoeia Convention. This is the USP seal that you may see on certain dietary supplements. It may have a seal from Good Housekeeping Research Institute or from consumerlab.com. These marks or seals usually indicate that the product has met certain manufacturing standards. Check the label to see if researchers have tested the product. Contact the manufacturer for test results in some cases. They have a phone number on the back. Ask your doctor to explain anything that is not clear. Always be skeptical. if I haven't made you skeptical enough already of claims on labels, particularly those that say the product can cure cancer. No single remedy or treatment can successfully treat all cancers. So anything that attempts to make such claim, you have to be skeptical of that. And no dietary or natural product to date, I mean, this would be our goal, of course, in cancer care, can cure cancer. Ask your doctor about safer standard treatments for your ailment that may have been proven effective. For example, and I know you all understand this, but always consider other options such as yoga in some cases, meditation, acupuncture, exercise, incorporating this and looking at your overall lifestyle, any sleep hygiene, anything that can be attempted before looking to a supplement definitely is something that everybody has to look to before looking to supplements or medications. So always think about that. Just a few examples. So now looking at specific herbal products in oncology. So the first class of supplements we will consider are antioxidants. Antioxidants are found in many foods. Common examples being vitamin C in citrus products and resveratrol that we have in grapes and red wine. Antioxidants work to eliminate excess harmful substances in and to the body, and they are therefore shown to have benefits, including but not limited to reduction in risk of cancer progression by eliminating excess harmful substances, reduction in harmful substance mediated adverse effects. But there are risks, especially to someone on chemotherapy, and there are controversies to consider. Namely, antioxidants work to identify anything that's foreign in your body and essentially attack it. chemotherapy is foreign to the body. Therefore, if you are on chemotherapy and take antioxidants, the antioxidant will try to attack the chemotherapy and therefore essentially try and undo or stop the effects of chemotherapy. Also, the antioxidant's goal is to protect your body. So it may protect the very cancer cells we're trying to get rid of with chemotherapy or radiation. And overall, many of these antioxidants lack an established benefit. With all that being said, the question becomes, how can I safely approach antioxidants while on chemotherapy? What we know is that the amount found in food in a healthy, balanced diet is safe, and in fact, we encourage these antioxidants sources that you find in many fruits and vegetables that some I've highlighted. So while on chemotherapy, your physician may encourage a multivitamin. One thing to note about a multivitamin is that it does not have, especially a reputable one that has, for example, a USP seal, it most likely, and you always have to look at the back and make sure it doesn't have mega doses of one ingredient, and therefore, in these cases, it would be considered safe. What we are advising to stay away from in terms of antioxidants is taking those single ingredient antioxidant supplements, such as mega doses of vitamin C, if you're on chemotherapy, if you're already on another therapy. And because I can't advise this enough, always ask your provider before taking any supplement. So vitamin D is important to all our bodies, as I've mentioned already. Much of the population is deficient in vitamin D, and the darker your skin tone, the harder it is for you to maintain levels of vitamin D. Vitamin D is not naturally made by the body, and sources of vitamin D help explain part of the reason we see these deficiencies. Sun exposure, specifically direct UVB light, is the best source for your body, that being exposed to sunlight. And it, as when your body's exposed to sunlight, it makes vitamin D. But of course, we know the sun can have harmful effects, and we must limit sun exposure from that regard. One thing to keep in mind is that there's no study that's shown that sunblock would block or prevent creation of vitamin D. And therefore, if you're going to be out in the sun for vitamin D, make sure you wear your sunscreen. Very few foods in nature contain vitamin D, and this also contributes to the problem. The flesh of fatty fish, such as salmon, tuna, fish liver oils, these are common sources that we find in foods. Small amounts of vitamin D are found in beef liver, cheese, and egg yolks. With some foods, you see the product says that it's been fortified with vitamin D. This is commonly seen with milk. Fortified, of course, means product's been added. It's not naturally occurring. Now, with vitamin D, the goal is a level greater than 30. With respect to all anti-cancer benefits, we know that healthy vitamin D level can have many benefits that contribute to a decrease in risk of cancer. And this has been validated in certain cancer types, including colorectal, breast, prostate cancer, through multiple clinical trials. So if you have not already, get your vitamin D level checked, and then proceed with whether it's adding on a supplement, which supplements help some, but also looking to these natural sources as well. So turmeric is another natural product which has received some attention in recent years. Turmeric itself is a plant native to Southeast Asia, used in food such as curry, and it's what gives curry its yellow color, as well as used in medicine for benefits we will examine. And oftentimes you see it used as a dye for its deep, distinct yellow color. So the main active ingredient in turmeric is curcumin. So just so this isn't confusing, you may find in the herbal section cumin. This is a totally different spice. So always look out for that possible confusion that can happen between those two products. Curcumin has many noted potential benefits in medicine, anti-angiogenic effects, whereby that it means it can potentially, what we see with anti-angiogenesis is starving the tumor from nutrients and or oxygen so the tumor can't grow. The curcumin can also have anti-inflammatory effects, antioxidant effects, as well as antimicrobial, antiviral, and anti-diabetic effects. In fact, in certain cancer types, it's been found to have some uses and effects, including decreases in PSA level, in prostate cancer, reduction in radiation dermatitis, severity in patients, in breast cancer. So with all that being said, there are precautions to take with turmeric, especially if you are a patient with cancer and currently on chemotherapy. First off, it interacts with many medications, and there are established interactions with certain chemotherapy agents. It's been known to impact as I said, effectiveness of chemotherapy. It may increase the risk of kidney stones. Further, one of the major effects of turmeric is the antiplatelet blood thinning effects. And this can be a real problem for patients with cancer and on chemotherapy, as chemotherapy can already have platelet or effects on lowering your platelets and cause blood thinning. Turmeric carries other risks, including but not limited to potential skin problems. Overall, where the goal is to maintain a healthy and balanced diet, turmeric is okay in small amounts found in food, added for flavoring, but in general, we would not advise taking mega doses, just scoops of turmeric as a supplement while on chemotherapy or on these various therapies. So to evaluate your specific situation, as I've said in all cases, please consult your doctor. Now, certain over-the-counter supplements have been noted for their potential benefits in managing certain adverse events. Just checking how I am on time. All right, so chemotherapy-induced nausea and vomiting. The most popular products with claims here include ginger, vitamin B6, as well as cannabidiol, more commonly known as CBD, or your marijuana products. These products have been shown to have some benefit when used in combination with medications prescribed by your physician. So with regards to ginger, clinical trials have shown that doses of 0.5 gram to 1 gram daily are effective when used in combination with medications prescribed by your physician in reducing chemotherapy-induced nausea and vomiting. And studies at higher doses, such as up to 2 grams, really showed no difference compared to these lower doses. And in some cases, when you go high and higher than this, they can worsen the side effect of chemo-induced nausea and vomiting. And as we've noted with other options, it's important to be aware of potential drug interactions. So always check for this. Vitamin B6 or paroxetine has been shown to be effective in clinical trials at doses of 25 milligrams orally once or twice daily with some therapies. But again, ask your provider before adding this on. Cannabidiol or CBD found in marijuana products also has claims to help with nausea and vomiting, but there are several things to note here. OTC marijuana products are not regulated. Clinical trials have actually found that 70% of marijuana products sold online are mislabeled, either over or under labeled in terms of the specific levels that they contain. And many cases, most cases don't contain as high levels as they claim. And in some cases even contain too high levels and may cause harm in that regard. Smoking or vaping marijuana products should be avoided, as it puts patients at increased risk for fungal or respiratory infections, especially when we're thinking about patients with a already suppressed immune system. So under Haley's HOPE Act in Georgia, certain patients are allowed legal possession of low THC oil for certain conditions. But at this time, there's no legal way to obtain or manufacture this in Georgia. So other notes to minimize nausea and vomiting: avoid or limit caffeine and smoking. Stay hydrated, which of course is tough if you're already nauseous. So the tip here is to try and sip small amounts of water throughout the day. Regarding chemotherapy-induced peripheral neuropathy, more commonly known as damage to the nerves or peripheries, those, when we say peripheries, we're saying fingers or toes, where the first signs may be tingling or sensitivity to extreme temperatures in these peripheries. This can actually, in some cases, mean permanent nerve damage. So it's very important, if this is, first off, if it's happening, let your team know, as then we can discuss options. So in 2014, guidelines were released, which basically stated no agents could be recommended for prevention due to lack of evidence, but that specific agents, in fact, should be avoided. In considering specific options, some agents, including fish oil, vitamin B complex, may or may not be beneficial, but the evidence is limited. Certain products show no benefit or potential harm, and these include acetyl L-carnitine, IV calcium and magnesium, glutathione, vitamin E. But all that to say, we always, as a medical team, try and make sure that these levels are at therapeutic level. You know, if there's a deficiency in these, definitely want to address this deficiency. Other alternative options that may help, as I discussed earlier, non-medication options such as meditation, acupuncture, physical therapy, exercise to help improve circulation. Always consider these options and how you can incorporate these into your life. You know, exercise, I know we harp on this and it's difficult, you know, even at our healthiest sometimes, you know, we're tired, fatigued, it's difficult to incorporate this, but even a brisk walk, anything that we can do to increase our level of exercise and movement definitely helps. So in consideration of other potential side effects, specifically cancer-related fatigue, we see ginseng, L-carnitine, coenzyme Q10, guarana, with claims of benefits, but none have been validated by strong studies. Same thing with insomnia. Products, for example, melatonin, they may help, but studies are not as strong. And you have to consider the potential side effects and adverse effects before adding on these products. And again, talk to your doctor. This may be an option, but we have to consider the full picture. Chamomile, such as chamomile tea, these are safe as long as, again, always about verifying the source of the tea. Is it a reputable brand? Those sorts of things. Echinacea, for example, has claims of immune stimulation, but again, the strength of the data is low, but always consider risk versus benefit on, you know, if this is something that you could possibly incorporate without potential harm. Some of the major things to consider with products, again, I mentioned blood thinning effects, especially if you're on a blood thinner or chemotherapy, that can already have antiplatelet effects. Such potential herbs and supplements to consider include those listed here. You have, for example, bilberry, garlic, ginger, ginkgo, donquay, but then also always consider these products, run a drug interaction check. But then we also have to consider there's other products, other effects, hormonal effects also. When you look at certain isoflavonoids that are in soy products, for example, these can produce a weak estrogenic effects. And so if you're on hormonal or a chemotherapy product that may have hormonal effects, these are things to consider. Another concern with over-the-counter medications and supplements is that they can change the effective dose of an oral chemotherapy agent by altering the drug's absorption in the GI tract. For example, select oral chemotherapy agents require a certain stomach acidity to be properly absorbed. Prilosec, a common brand, the generic name is omeprazole, for example. It's a common over-the-counter proton pump inhibitor that we have for GERD, gastroesophageal reflux disease. It works by decreasing the amount of acid produced in the stomach. So this means a patient taking Prilosec or other similar medication, there's other medications out there as well, they may get a lower dose of their chemotherapy that may be prescribed by the provider we are aiming for a certain dose and a certain level of this chemotherapy agent. Aloe vera is another example as well. This can, when you're taking, for example, aloe vera juice or other products that you may ingest that contain aloe vera, this herbal supplement has the potential to decrease intestinal absorption because it can have what we've seen as stimulant laxative effects. So always consider what you're incorporating into your diet, as it may have an effect as well. So now, when looking at grapefruit juice, this is a common one that we see. If you're on medications, always check if grapefruit juice will interfere, and what is that interference? It stops certain enzymes from metabolizing medications, and that's the effect. This can result in increased levels of medications. These are just some listed examples of medications whose levels can be increased by grapefruit juice. You all, as patients with cancer, these are common medications we see: cyclosporin, tacrolimus, sunitinib, nilotinib, and oxycodone for pain. Pomegranate, pomelo, cranberry, Seville oranges, lemon can have similar effects as grapefruit juice. So always consider, amount becomes important here as well. So always consider, these potential drug interactions. So St. John's wort is also a supplement with claims to help for mild or moderate depression, anxiety, and sleep problems. We've seen that it can have effects on certain drug levels of products, and it can affect plasma levels of other supportive medications that you may be on for your cancer treatment. So always look out for these potential drug interactions. So now we are towards the end. One important thing, I think, there's so many claims out there, so many different dietary supplements. I tried to focus today on your most common ones with some reputable claims, but it's always important to know your resources. Yes, it's your healthcare team, but also knowing what resources exist out there. You can look to these resources and then come back and discuss with your healthcare team, or help them make sense of some of the information that's out there, or help or talk to them so they can help you make sense of some of the information that's out there. So some resources, Memorial Sloan Kettering Cancer Center has, if you just Google this about herbs, they have some very good reference where you can search a product and look up various claims, drug interactions. These listed here as well: Natural Medicines Comprehensive Database. You can check natural products for its effects, and it also has a drug interaction check there. The Natural Center for Complementary and Integrative Health. It has a guide as well for supplements. Chemocare.com is a common resource that we use as the healthcare team to look up specific chemotherapy agents, and whereby they talk about various side effects, various effects of various other products in some cases. The FDA also on its website has tips for dietary supplement users. Federal Trade Commission as well, also addresses cancer treatment scams. So this becomes important if if there's something out there about your product that you should know. So despite, looking to all these resources, again, it's always important to come back to your healthcare team and make sense of what exists. They might find something that's in fact been disproven since it was first published. So always come back and discuss with your healthcare team. So at this time, that concludes our discussion. And I'll turn it over to Jennifer for some questions.
Thank you so much, Houda. That was really great. I have had a bunch of questions and I'm trying to consolidate some of them, but I did just want to put in a plug for the Memorial Sloan Kettering website about herbs and botanicals. I use that one a lot. I recommend that to patients a lot. And in fact, one of the questions that came up, I was Googling that website just to double check and see what they said before I sort of was formulating an answer in my mind as to what that was about. So that really is a great one to try. I wanted to start because this may be occurring with several people, but I have a listener who has cancer and has been avoiding a lot of OTC products, obviously, but now has COVID and is having a lot of congestion and wanted to know what safe over-the-counter products would work for congestion and coughing. Is Sudafed okay? Is Benadryl okay? Things like that.
Yes, very good question. So yes, it's always with, we're all working through COVID right now. With COVID, it really becomes whether, looking to specific therapies, such as, for example, your monoclonals that exist out there, but then it becomes a lot of symptom management, as you're describing. So when looking to Sudafed, for example, the Sufedrin product that exists in it has potential interactions, has potential side effects. One thing is that it can increase blood pressure. So if you have high blood pressure, are on antihypertensive agents, see where your blood pressure control is, talk to your provider. One thing to look out for with Sudafed, I'll reiterate, is that increase in blood pressure. Also, depending on what specific other therapies you're on, there may be drug interactions, so I would look out for that. With Benadryl, antihistamine, it's a histamine 1 blocker. Be careful with your other, with your cancer treatment. Your regimen may include Benadryl already, or it may include another antihistamine blocker, specifically histamine 1, an example being Claritin. So when incorporating Benadryl, yes, it could potentially be safely done, but think about other sources of Benadryl you may already be getting in your cancer treatment, but also think about the potential side effects of Benadryl. Of course, it causes somnolence. If you're driving to and from therapy, always be careful of that. Potential for drug interactions as well. These are sort of things, I always think about, we as healthcare providers think about the effects of the agent, potential side effects, and then potential drug interactions. So always run through this. If you mark all of these and you're safe, then yes, just taking them at therapeutic doses for symptom relief is definitely something that could be done, but as long as it's done safely.
Okay, and you answered this question about nausea and vomiting, but it came up in the chat for sleep and pain. What is your opinion of CBD oil as a supplement for sleep or pain?
Yes, so CBD is something that I always, and it becomes, of course, difficult to talk to your healthcare team about it, but it's something to be careful of. There are some prescription medications that contain CBD. So for sleep, pain, nausea, vomiting, there may be options out there that we can take that are regulated, that your healthcare team may be able to incorporate. So I would say, talk to your provider. We want to make sure that the source is a safe source. So think about also what you may already be on for example, for nausea, vomiting. Is there an alternative that we can try before jumping to a product that contains CBD? This is something that we always evaluate as a healthcare team. So I would say it's important to loop in your healthcare team. These products, yes, they exist and can potentially provide benefit, but it's considering your overall care as well and your overall other medications as well becomes very important.
So it sounded like on your slides that really there is no truly good data about using vitamin D for peripheral neuropathy, but I do have someone who's asked the question, in your opinion, is vitamin B6 or B12 a better product for that?
Right, very good question. So vitamin E, vitamin B, vitamin D. So I'll first address vitamin D.
Oh, no, this is vitamin B.
Okay.
B as in boy, B6
Okay.
and
Okay.
B12, I'm sorry.
Okay, perfect. Yeah. Okay. So vitamin B, yes, there is insufficient evidence, but the amount that you may be getting, balanced amount, making sure you're getting it from, these are obvious things, but food sources, getting a fair amount from multivitamin, this is safe. But overall, there's insufficient evidence for vitamin B6 for peripheral neuropathy specifically. So again, rather than mega doses, I would make sure, I'm getting a balanced amount from my multivitamin as well as food sources, assessing other potential options, and then discussing, maybe your doctor will check your vitamin B level. Maybe you have insufficient absorption, then go from there.
I have a question. Do you recommend taking D3, D as in dog, with K2?
So K2.
I don't know. I'm wondering if that's a potassium supplement or that's why I was asking you, because I was not familiar with that.
Yeah. I'd have to see that specifically.
Okay.
Yeah, I'm not sure if it's vitamin K.
Vitamin K, yeah. The person who asked that question, if you can clarify a little bit, that would be great. Then someone's saying, what exactly does it mean that bilberry is showing as an antiplatelet?
Right. So bilberry can have, essentially it's been found that it can have effects on blood thinning. So when incorporating it, we have to check, are you on other anticoagulants, antiplatelet medications? It could possibly all these things. I talked about garlic, ginger, bilberry, all these things that could be incorporated possibly without effects, but we always have to consider what other medications, your overall antiplatelet or your platelet level, all these effects.
Okay. And I do want to mention that just in my own personal experience, one that really trips some of our patients up is things like Goody's backache powder, because it sounds so innocuous, but it's sounds so just normal. But if you look at the ingredients, it's got lots of aspirin or ibuprofen in it. So that's why you really have to check the labels on these things. It can be scary how many products are out there in which there's a piece of it that may actually not be helpful to you and possibly be harmful to you. Next question. If you have an infusion, a FOLFIRINOX infusion every 2 weeks, can you take supplements in between treatments and just not during the actual 46 hours of treatment?
So an iron infusion every 6 weeks?
Sorry, FOLFIRINOX.
Oh, I'm sorry.
5-FU, leucovorin.
Yeah, okay, I heard that. I'm sorry, wrong. So it depends. If it's a multivitamin balanced amount that you're getting, vitamin D, if you're taking a single dose of vitamin D, these things have been proven, they won't have effects. But if you're talking about antioxidants, definitely consider the effects if you're such as mega doses of vitamin C. Definitely consider the effects that these could have on chemotherapy. If, say, you're taking your 5-FU, FOLFIRINOX, every 6 weeks, you're on a multivitamin, your vitamin D level is low, so you're taking a vitamin D supplement. These are all okay and won't interact while you're on your therapy. But definitely look at your products, consider what you're taking, what else you should be taking, and the doses as well in these products.
And I have a participant who says she or he has been taking 8 rounds of chemo for over a year, still has taste loss to certain foods, and is on an antifungal for oral thrush. Is there anything that they can do? It sounds like for the taste loss. And anything, yeah.
Yeah, and this is a common thing, especially with our platinum agents. I'm not sure what specific chemotherapy regimen, but cisplatin, carboplatin. Unfortunately, this is a potential effect, and it does take time for the taste to sort of regulate itself and come back to whether it's not, in some cases, unfortunately, and I know your medical team has discussed this, it's not a back to full normal, but a new normal where taste does come back. But in the meantime, really just things that can be done, avoiding, and it's usually a metallic taste that you may have as well, avoiding metal utensils. Has been shown by patients, talking to patients, that this is something that can help, less spicy foods and whatnot, but really it just takes some time, unfortunately. I wish there was something that could help as well.
Okay, I have a sort of controversial question. We'll see how you do. In your personal opinion, do you think that there is a lack of studies on natural supplements because there's no money in it and it goes against Western big pharma?
Yeah, I mean, that's, and this is
a common,
common
question.
Common question. Yes, this is where I discuss so much of the regulation up front. It really becomes how these products are regulated affects this a lot. Whether or not we can stand by the certain claims, a product may not go through because it doesn't go through the full regulation. It may in fact show some claim or prove some things and whatnot, but just because along the way, we couldn't really validate some of these things. Yeah, it becomes, it is a controversial thing, and we in the United States, Western hemisphere, we look to the FDA for guidance and whatnot, but it becomes difficult. What we can validate, what we can stand by, you would have to have someone look into the exact study that was done and whatnot. Yeah, it's not an easy thing to address.
And then the person who was asking about the K2 did write back and say again, D3 with K2. So I'm not sure what that is. A 12-year ovarian cancer survivor attended an integrative medicine conference or conferences. Therapeutic doses of D3 with K2 has been used with success for fighting cancer and helps against COVID apparently as well, not during chemo though. So again, I don't think we can really address that in the sense that I don't think there's any literature to support that it helps against COVID, but I'm not sure unless you've heard of something, Houda.
No, I have not, and I'm actually trying to look right now if it's something that has anything that just stands out, a USP seal or anything along those lines. I would have to look into that more closely. I'll be interested to look into it. Maybe Emily can help connect me with this patient, or maybe I can provide more clarity to the whole group, because definitely if it's making claims about COVID, I think many of us are interested.
And then this question is actually for Emily, which is just that this was very useful information. Several people logged in late, and will there be a recording or copies of the slides available
Yes,
on
Jennifer.
the website?
Thank you for asking that. Yes, we are recording this program currently, and it will be available in our website in the coming weeks. We just have to download and edit it for content. So that should be available. I know people have asked for the slides as well. And Houda, I'll leave that to you. If you want to share your slides, we can put those on our website as well.
And at the moment, I see no further questions. So let's just wait one more minute in case someone is frantically typing at the moment. And then, and in the meantime, thank you all for attending. I noticed we had over 40 people, which is just fantastic. And we really, really appreciate you taking your time to listen to this very important topic. And I've had several people say, Houda, this was very useful information, and thank you for your time.
Well, thank you all.
And then someone just sent me a copy of the study that references this D3 plus K2. So I'll make sure you get that, Sylvia. Obviously, I haven't had, Sylvia, thank you. Houda, I haven't had a chance to open it yet, obviously.
Okay. Yeah,
okay.
We'll look into it more closely. Thank you.
Okay. Great. Thank you all so much. We really appreciate it. Houda, special thanks to you. And Emily, a special thanks to you setting this up for us.
Thank you, Jennifer. Thank you, everyone. Jennifer. Thanks, Emily.
Yes, and thank you, Jennifer, for bringing your expertise as well. That was very helpful to hear from you.
Oh, good, good. Okay.
Thank you.
All right, everyone. Well, have a wonderful rest of your day. And if you did have any questions you wanted to follow up with Houda, you can email me, emily@cscatlanta.org, and I will forward those on to her. If you had a question that maybe needed a little bit more exploration, I'm happy to do that.
Thank you. Yes.
And Emily, can you see the chat even though some of the questions were directed to me? Or do I need to re-forward those to you or copy them to you?
It probably is easier to have them email me directly rather than you trying to copy, because I might not be able to see their email address to respond to them. Once this is closed, I can't see the chat anymore.
Well, I guess, so I've got this article here, and then there's some names of people. You should be in the name of the person who was asking about the K2.
Yes, I see the article here. Okay.
See the article, and then the person who was asking. So it's two different people. Do you see? One sent the article, but it was a different person above who was asking about the K2.
Yes. Okay.
Okay, you see both of those?
Yes.
Okay. And then as Sylvia said, which was what I was just about to say, someone should be able to get a download of the chat from Zoom. That's what we should. Thank you, Sylvia. You're absolutely correct.
All right, ladies.
Okay,
well, have a wonderful rest of your day.
Thanks, everyone.
Houda, thank you so much.
No, thank you, Jen. Thank you, everybody. Take care.
Bye-bye.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.